Good morning, everybody. Welcome to our panel on global health reporting. I'm thrilled to see you all here, even though it's early morning. And I'm also thrilled to see our panelists here on the floor. This is actually the first time that we are having a panel on global health reporting on the World Health Summit, so it's quite an achievement, and it wasn't easy to convince everybody to have this panel. Even more, I'm positively surprised that we can finally be here, because this topic is of great importance. We talk about global health all the time. We've been talking about global health for the past 15 to 20 years, but we have not seen enough reporting on global health topics. Over the past 2 to 3 years, global health reporting became more and more important because of the pandemic situation of COVID-19, and everybody wanted to see good and concrete news about what was happening around the globe. Journalists were overnight forced to report on a topic which they might not have been exposed to in their previous lives, and they were under enormous pressure to come up with good and quality health journalism. Quality health journalism cannot be seen as a guarantee, as something which is guaranteed, and that's why we come together here today to talk about what makes journalism quality health journalism and what can we do in order to achieve better quality health journalism in the future. What is the reason? Why did so many journalists were facing issues to come up with good stories? There are various reasons behind the lack of quality health journalism. One reason is, of course, that journalists have to work under pressure. They have to come up with good stories, sometimes overnight, and this is not always possible. Why is there such a pressure? The pressure also comes up because journalism has been seeing shrinking finances over the past 10 to 20 years, and to actually travel to countries where many global health topics are happening is no longer happening. Even for the big papers, newspapers, magazines, journalism on site has become tremendously difficult. And last but not least, what is also a big challenge for many journalists and health journalists is proper education on health journalism. Nobody has turned into a public health expert overnight who had to report on COVID-19. So journalists were actually not properly educated to report on health stories. So these three issues we've been seeing and facing over the past years and also decades, I would say, and that's why we come together today and we are going to talk about all these issues. Last but not least, one thing I want to underline, which is extremely important to me, having worked as a global health journalist for the past 20 years, over the past years, I have seen a lot of miscommunication and misinformation about global health topics, and this has caused a lot of uncertainties into the international community about how to go about certain topics, how to move forward, whom to trust. So trust and information, proper information, are very important components of our today's discussion on global health reporting. So let me briefly tell you the outline of our panel. We will have 90 minutes, as all panels have 90 minutes. I'm very sure we will run out of time. And but we do our best to cover all the different aspects. So number one, we want to understand realities around the globe from different journalists working on different continents. This is why we have some very renowned and experienced journalists here who will share their experiences on reporting and specifically on health reporting. But we will also talk about support structures for journalists. So what does it need to better support journalists around the globe to be able to cover health stories properly? This is what we will be talking about next. And then last but not least, we want to talk about the importance of education for journalists and education on health reporting and science reporting, so that if the next pandemic comes, they will be properly trained and informed about the specific issues. And then lastly, we will discuss keys to quality journalism, because we don't only want to complain about what is going wrong or what has been going wrong, we also want to understand what is key to quality journalism and what solutions we can use in order to be properly prepared. And then last but not least, of course, we have you here, our audience, which we would like to include. We want to hear your questions, your comments, and maybe the challenges. If there are some journalists among the audience here, we want to hear your stories and your challenges and maybe your ideas as well. So having said that, let me say that I'm very proud that we have excellent people here on our panel, on site, as well as two very experienced experts joining us remotely. We have Gwen Lister here, the lady on the left, on my right, on your left. She's a lifelong reporter and journalist. She's the founder of a very important newspaper of the Namibian, and she will tell you more about her life story, about the founding and the challenges she was facing. She's also a trainer of journalists and has worked in the field of training, which is very important. And she has won numerous awards. Let me just name one. She has been announced as the World Press Freedom Hero in the year 2000, and she can be extremely proud about this achievement. Currently, she's a trustee of the Namibia Media Trust, so she still has her hands and fingers involved in all the issues which need to be decided and to be covered. So Gwen, a warm welcome to our panel.
Thank you, Martina.
Very happy to have you here. Next to Gwen is Luz Rimban. She came all the way from the Philippines, one of a country very close to my heart. We've known each other for many years already. Luz is the executive director of the Asian Center for Journalism at the Ateneo de Manila University in Manila, the Philippines. And she's also a program director of Ateneo's Masters in Journalism. And one module of this Masters is actually health journalism, which has become tremendously important over the past years, as we have learned and heard just now. Luz is a journalist herself. She has been working in journalism for more than 35 years, so she has seen two parts of the coin. On the one hand, she has the heart of a journalist, and on the other hand, she's into education and training because she wants to make sure that all the things that maybe she has faced will be addressed now properly. So a warm welcome to Luz from Manila. Then we have next to Gwen and Luz, we have Jan, who is a public broadcast editor at the Science and News Desk of the Bayerischer Rundfunk. So she didn't have to travel that long, but also quite a few hours. She comes from Munich, and she is specialized in medical research and public health. So she has been covering all the topics we are talking about here on the World Health Summit for quite some time. She has also reported from the World AIDS Conference several times, and she is a grantee of the International Journalist Programs and has also reported on site from quite some countries. A warm welcome to you. Now I can see two more people. I'm very happy that everything worked out with the technical situation. We never know what challenges to face in the last minutes. So we have Joanne Silberner here. Two ladies have glasses. I was just about to say the lady with the glasses, but you both have glasses, as I now realize. So Joanne, happy to see you here on board. Joanne is an extremely experienced health journalist, and I have met her also many years ago when we worked together on an article, and which was a great experience. So Joanne covers health and health policy and medicine for more than 40 years, and she's working as a print and as a radio reporter at NPR in the United States. She has also taught journalism in the United States at the University of Washington, and she has also worked in London at the British Medical Journal and wrote pieces herself and was also editing for the BMJ's news desk. See, she is even more than that. She is a founding member of the Association of Healthcare Journalists in the United States, which is a very important association, and I wished we come up with such an association here in Germany. Maybe we can think about that after this panel. And she has won numerous awards in science and medicine reporting. And last but not least, long list, she's a grantee of various fellowships to do health reporting. So thank you very much, Joanne, to be here, to join us remotely. Welcome.
My pleasure.
And lastly, but not least, we have Marjan Tillmans here with us on board. Marjan works for the European Journalism Center based in the Netherlands, a very important organization because it supports journalists from around the globe. She is project manager and parts of the grants team. We will talk about why grants, fellowships for journalists are so tremendously important. And these fellowships also supported research on global health and health security, also with the support of the Bill and Melinda Gates Foundation. Let me add this as well. So we are very happy that the EJC is here on board with Marjan here joining us, and we are very thankful that there are grants like the one of EJC. So welcome on board, Marjan.
Thank you.
So now let me start our discussion. We said we want to talk about various aspects of global health journalism, research, and challenges. First of all, we would like to understand realities on the ground. Which realities are journalists facing around the globe to report on health and science, to report on global health? So when, as we have learned, you come from the African continent, you come from Namibia, and you have seen various of these challenges over the past decades, challenges to quality journalism. Now we want to learn and to dive into the African perspective. So Gwen, the floor is yours.
Thank you very much, Martina. If I may just briefly segue into something you said earlier, and that is that I'd also like to commend the World Health Summit for having this panel on the critical question of quality journalism and its indispensable role in the health sector. I've been attending some of the panel discussions after the past day, and obviously I haven't been to all of them, but the one thing I have noted with some significance perhaps is I haven't heard any mention of the words media or journalism. And that to me is somewhat perplexing because I feel it's almost impossible to talk about global health or even hope to achieve Sustainable Development Goal 3, aiming to ensure healthy lives and promoting well-being for all ages, without recognizing media's very crucial role in informing, educating, and helping to build healthier and more equitable societies, as well as also in trying to push back against disinformation and propaganda that is always so prevalent, especially in times of crises. And we experience that firsthand with what is happening in the Middle East right now. So hopefully next year, instead of just a side panel, the subject of the role of quality journalism in the health sector can be a plenary or the subject of a keynote discussion. We can hold thumbs and hope that will be the case. But anyway, Martina, just to get right to what you actually asked me, I recently asked a young journalist, one of those that I'm mentoring, what health reporting means to her. And she responded by saying as follows, that it was not only necessary for the well-being of citizens, but also because investigative solutions-based journalism helps in guiding the national budgets in our various countries on which areas need crucial attention. She also added that while health reporting was her passion, and I think there are a lot of young journalists on the continent who feel passionate about health reporting, and that it was very important to push back against disinformation by getting the facts right and using science to back up those facts. Namibian newsrooms, and I think this speaks to Africa further afield, simply don't have the capacity or the resources for dedicated reporters on the beat of health. And this in turn may compromise the quality of the work that journalists put out in this very critical field. So I think her observations don't just apply to Namibia, but very specifically to other countries on our continent. And I think her remarks also bear testimony to the fact that health reporting in Africa doesn't always get the priority it deserves. At the same time, there are definitely other constraints to quality journalism in general, and health reporting, obviously, in particular, that we need to mention. And I think it's vital to recognize that informing the public about health issues is often difficult or even near impossible for journalists in countries where democracy is either non-existent or under threat and human rights are compromised. There are huge pressures facing journalism's crucial role in informing citizens in order to enhance their participatory role and to empower them with the knowledge to take vital decisions around their own lives. And I think this is especially when it comes to countries where the gap between rich and poor has really become obscene. In vulnerable and marginalized communities where poverty is rampant, and also when it applies to primary health care, which is a huge priority and where many people are at risk. Namibia is currently ranked #1 in press freedom in Africa. And here in my country, a mostly enabling environment for journalism exists. But this wasn't always the case. And I don't want to dwell too much on it, as Martina briefly referred to my personal background, but I do have a lot of personal experience back in the day of fighting against a draconian colonial regime for the rights and the freedoms that we enjoy today. But I think what's significant to notice is at that time, we were always forced to cover or to report on the immediacy of the war and human rights violations. And while that has to happen, issues like health are forced to take a back seat or put on the back burner. And so too, I think this is the case with many of the health reporters in conflict zones today. They're covering the actual war because that is the question of immediacy, and things like health certainly don't enjoy priority. Obviously, victims of war is very much a health issue. But I think it's also important to mention that financial viability, or perhaps we should say financial sustainability, and lack of capacity are the main constraints on good journalism in Africa at present. I mean, I think everybody knows that journalism has been hit a very heavy blow, mainly by the digital tsunami, which has taken the world by storm, and very few people, or less people, are consuming what we call traditional or legacy media, always known to be the kind of repository of quality reporting, and instead being more attracted by the clickbait that is online, and that's unfortunate. But I think whatever the reasons for that, journalism really had some heavy blows, which were then exacerbated by the COVID pandemic, where really it crippled journalism even further. There's also the problem of a lack of public trust. On the African continent, a perception survey called the Afrobarometer has noted very serious declines in lack of trust in the media on the African continent in the last 10 years. Prior to that, it was very different. I mean, we can talk long about why that is the case, and that's not really the subject of this today, but I think it's important to note for the fact that quality journalism is not or doesn't have the appeal that it had many years ago. We need to, all of us, interrogate why that is, because there's no point in quality health reporting if nobody is reading, listening to, or watching that reporting. But also, I think the lack of enabling environments the world over and threats and to the safety and well-being of the journalists themselves is very important. I mean, it's horrific to note that in addition to the civilian toll, the huge civilian toll in the Israel-Palestine ongoing conflict, that this week alone, 12 journalists were killed, 8 have been injured and 2 missing, according to the Committee to Protect Journalists in the US. And I mean, that's a huge number and very concerning as well. I also think that there are a number of other places on the continent where there are serious constraints to journalism. And one of the places we actually saw this, or during the COVID pandemic, was the fact that many, many African journalists came under fire. And governments on the continent often used COVID as an excuse to clamp down on good journalism. So whereas you could say that under COVID and during the pandemic, that most journalists became health reporters, and that post the COVID pandemic, this is no longer the case, obviously, and health journalism seems to have again disappeared into the abyss. So we need to look at ways and means why this is and what can be done to move health reporting forward.
Exactly, that's a very important point, and I think we need to discuss on how to keep interest in health reporting alive, because even though the pandemic is over, global health reporting should not be over. The interest should be kept alive, and it's very sad to see that even finances are going down these days for journalism, but also for many other global health topics.
Absolutely.
Yes, so thank you so much, Gwen. Let us look into another continent, the Asian continent now, and let's look specifically into the situation in the Philippines. Many or some of you might know that the Philippines have undergone very difficult times under the Duterte presidency, and Luz will be able to give some insights into why there have been so many challenges for journalists during the time of Duterte and even beyond that time. Luz.
Thank you, Martina. Before that, I'd like to say that I'm honored and pleased to be in this summit and to be joining the conversations on health, global health. I'm the executive director of the Asian Center for Journalism. Before that, I spent many years as a television reporter, first a print reporter, then television, and then I joined the nonprofits, the Philippine Center for Investigative Journalism, and then I helped found another nonprofit called Vera Files, which is currently conducting fact-checking. I moved to ACFJ in 2015. ACFJ is an academic unit under the Department of Communication of the Ateneo de Manila University. And it's the offspring of 2 institutions. One institution is the Ateneo, and the other is the Konrad Adenauer Stiftung Media Program Asia. Their mission was to promote excellence in journalism through the continuing education of journalists, and this means degree programs, certificate courses, diploma programs. I'm proud to say that Martina was among our visiting faculty members who taught health reporting under our Master in Journalism program. In fact, Martina was in Manila in March 2020, and she was supposed to be the main speaker of a conference titled Fighting Misinformation in Health Reporting. That was supposed to be held on March 13, 2020, the day that the government announced a widespread lockdown. Martina had to pack up and leave post-haste. Anyway, we continued the conversation online via Zoom, and we're very glad that a lot of Filipino journalists and Asian journalists joined the conversation. We believe that educating and training journalists is a continuing advocacy and a need because times are changing, media and its audiences evolve, technology demands new skills and understandings, and the context is shifting. In the Philippines, as I assume in some other Asian countries as well, health programs and issues are intertwined with politics and governance. Let me just give you some context points. There's an inequality in the delivery of healthcare in the Philippines between rural and urban areas. Rural areas lack facilities and medical personnel. Actually, the whole country lacks medical personnel. Health officials say the need is something like close to 500,000 doctors, nurses, midwives. Our population is 110 million, but we have only 280,000 medical professionals currently serving in our country. That's just a little over half of what we need. Since many are lured with better job opportunities in countries like Germany and the United States, the Philippines is the leading country of origin of nurses in the Western countries. We have a universal health care where all Filipinos are automatically members, but most members have to contribute to the fund. Senior citizens like me don't need to, and that's a huge benefit. Some Filipinos who can afford it or are gainfully employed, have good employers, get a supplement via private HMOs. The latest Philippine National Demographic and Health Survey says 27% of women, Filipino women, had no health insurance whatsoever. So Filipinos pay a lot for medical expenses from out of their own pockets, and these expenses could be catastrophic. There have been many studies on catastrophic health care. When you don't have health insurance, you pay 100%. With the health insurance, you can probably pay something like 50%. And that's really, that could impoverish families. The National Health Program has been plagued by corruption. At one point, it happened during the height of the pandemic, and it became the focus of news reports. Health is the third in our government's priority in terms of spending after education and public works. That's fine as long as the health budget is increasing every year. But this year, the health budget is suffering a cut of 8 billion pesos or 140 million US dollars. So this is the health context that Filipino journalists find themselves in. They need to communicate this. They need to investigate what it all means. But the public health reporting in our country leaves much to be desired. So I'll go to the slides. To illustrate, I scanned the news stories that came out of two main primetime television newscasts. Television remains the Filipinos' main source of news and information. So if you see this slide in front of you, one newscast, this is for a week-long period, 5 days, one newscast called TV Patrol had 102 stories for the week, an average of 20 stories a day. The newscast lasts about an hour and a half. The other had 112 stories. Did they have health stories? Did they cover health? Yes, they did. One had 4 stories out of 102, or 4%. The other had 6. Could they have done better? In terms of quantity, yes. There could be multiple health emergencies across the archipelago, but for this week, in one newscast, there were 6 other stories that could have had a health angle. So you see the number there. One newscast could have had 6, the other could have had 4. So in total, there could have been at least 10 health stories. How did they fare in terms of quality? The stories that classify as health stories can fall under the breaking news stories or more public relations type of stories. Can we have the next slide, please? So the health stories include stories about medical missions, territorial disputes among cities. There were opportunities to do bigger and deeper stories. For example, one of the controversies now hitting the health system in the Philippines is that the website of the National Health Insurance Program, PhilHealth, was hacked. This has been an ongoing story. Millions of the database was hacked. Millions of data profiles have been stolen or held hostage by a group of hackers. They're demanding 17 million pesos or something like 300,000 US dollars in ransom. Can you imagine that? So they could have done a deeper story. What is the effect of this hacking on ordinary Filipinos? It means a slow, manual, transaction? What does this mean in terms of the delivery of healthcare? This kind of information has been glossed over. The stories that could have had a health angle were also opportunities to provide the citizens with deeper information. For example, there was a story about an ammonia leak in an ice plant in a crowded community. It was covered mostly as a public utility emergency, minus the information about what inhaling ammonia can do to the body. And then we have stories about, we're in the Pacific Ring of Fire, so we have volcano eruptions, we have earthquakes, we have storms. There are lots of stories that could produce deeper stories about health, but it's been difficult. I don't see deeper stories on the newscasts. What's happening is that they devote more airtime to entertainment and crime, which is the safer and cheaper topics to cover. Part of me will say, we can't blame them. Democracy has been backsliding in the Philippines since 2016, and the existing Philippine media don't want to rock the boat. As you know, the previous president ordered the shutdown of the biggest broadcast company in the Philippines in one of these very shocking moves as part of his campaign to undermine and demonize the media. So you also know about Maria Ressa and the many cases she was filed with. What you probably don't know is there are other groups of Filipinos who woke up one morning in April 2019 and found their names, mine included, in the headlines as being coup plotters, journalists plotting to overthrow the government. Can you imagine that? I was just, we were just going about our work, and suddenly the government calls us coup plotters. Making an example out of ABS-CBN and Maria Ressa was enough to instill fear in all other media companies and media owners to this day, even as another president has taken his place, who happens to be the son of the dictator 50 years ago, who came to power, who declared martial law 50 years ago. Reporters Without Borders says the Philippines rose from on the Press Freedom Index from 147 to 132. I believe that doesn't reflect reality on the ground. It just means that things have been quiet, but not that things are better. Where do people get their information about health? The answer is in social media. According to the dataportal.com website, 75% of the total population is on social media, where a lot of fake news prevails. Filipinos love Facebook and YouTube, where influencers have replaced newspapers as authority figures on issues of the day. Countless studies and developments have shown how influencers peddle biased and fake news, sometimes to the highest bidder. And then there are messaging platforms which host chat groups around family, school, professional circles. Fake news spreads quickly on platforms like this. I recently heard the story of a man who had been drinking the juice of Carabao grass because his friend had advised him to, for good health. Now he's terminally ill in one of the government hospitals. So the situation doesn't mean we give up on the media. In fact, it points to the need to strengthen the community of practitioners, such as the one that we have at our center. Many journalists seek higher education because they're discouraged by what's happening, and they want to get off this hamster wheel that is journalism. So they go to centers like ours for retooling. So I'll stop there, Martina, and continue later.
Thank you so much, Luz. As we can feel and hear, so many things have been going on in the Philippines, journalists are working under tremendous pressure. It's unbelievable to see how many stories they have to come up with only within one day. And when I was teaching these journalists, they were so stressed, you have no idea. I mean, even we here feel stressed. But I mean, compared to what they had come up to in order to stay in their jobs, it was unbelievable. And many of them also were suffering from mental diseases because of the stress. This is not our topic, but let me say this is an important topic to some journalists as well. So we have heard some challenges, many challenges indeed, but there are also positive things to health journalism, and some people have been thriving because of the environment they were able to work in. And we have two people here from whom I would like to hear why working as a health journalist or reporter has been something very fruitful, and why we should invest into this profession. So the one is Joanne and the other one is John here with us. So I hand over to Joanne first, sitting there in the United States, because as I said, she has been working as a health reporter, science, medical researcher, and she has been thriving. Maybe because of the US setting, we will learn now.
Well, thank you very much. And thank you for inviting me to speak here. And I'd actually like to start a little bit like Gwen started, which is talking about how glad I am that you're having this panel discussion and how important I think journalism is to global health and to public health. And I'm fond of saying that when you say public health, the first word in public is public. I'm sorry, the first word in public health is public. And so much of what is happening in terms of efforts to improve public health have to do with communicating and communicating to the public. And I think especially challenging now is what Luz just mentioned, how many people are on social media and how many people are getting their information from there instead of from legacy journalism, which is where I think people should get information as a legacy journalist. And I think that that's a special problem in the global health world, is getting word out to people and understanding how journalism works. And I'd love to see more emphasis on that in future World Health Summits. How do you communicate with the public now? How do you use the media? How can you prevent abuse by the media? Because things can go both ways. So now I'll answer your question with the good things that are going on here in the US, but I'm also going to end with the bad things because it's certainly not all good. And when you look at the good things, I'm going to use COVID as an example. I mean, we should have been, journalists here in the US really should have been ready. A lot of us grew up through AIDS. AIDS was just coming out when I started out as a journalist. And for those who came a few years after, or even decades after, it was such a developing story and so important. And we all knew that we had to understand science a little bit. We had to understand how research is done. And this was back in the day when newspapers and TV were rich enough to have dedicated, almost the medium-sized and larger outlets all had dedicated health reporters or dedicated medical reporters. Some of them even had physicians as reporters. And then when I get to the bad stuff, I'll admit that those days are waning. You know, the bigger publications still have dedicated health reporters, but not all do. And why it's a good time, I think, in the US to be a health reporter is the resources that are available through NGOs. Now, when I started out at National Public Radio many years ago, there was actually a discomfort about taking money from some of the NGOs, taking grants from them to cover health, because it was allowing them to dictate coverage. Because of the realities of journalism and financing, those days are over. I think NPR and many other organizations are pairing up with some NGOs that are dedicated to, they really don't dictate coverage as much as people had at all, really, in my experience at least, as people had feared. But they provide things like there's a group that's now called KFF Health News that used to be called Kaiser Health News. That was established in 2009, and it uses, it's philanthropic money. It's not associated. If any of you are familiar enough in the US, we have some healthcare systems that have the word Kaiser in them. KFF Health News is not affiliated with them. It's independent, and they have no advertising, and they have a huge stable of reporters who are very carefully trained, and editors too. Editors are very important to this process. Editors as well who really understand health. They have training sessions. I know, but I've been involved in some of them way back when. They're very careful to train their reporters in health concepts and statistics. You know, they're not scientists, they're not researchers, but they're journalists who understand the questions that should be asked when you're approaching things. So there's KFF Health News is out there. There is a group called the Pulitzer Center for Crisis Reporting, which is actually international. They have a very active journalism group. They consider health part of their crisis. When I first applied to them for a grant, I thought they only financed war reporting, but they said, no, health is a crisis too. So it's the Pulitzer Center on Crisis Reporting. I think they even dropped that from their name. They're very active in providing grants to people to travel to other places, which I think, especially in global health, but even in regular public health, local public health, you can learn so much from what's happening globally, and they provide financing for that. There's something called the Association for Healthcare Journalists, which Martina mentioned, and I was one of the co-founders back in 1998, and I admit we thought of it as a social club, that we got together after some of the medical meetings that everybody went to back then and said, hey, we should kind of have a club. Well, eventually at some point after I left the board, they hired a professional organizer who was just amazing. And he turned this organization that more than 1,000 members. I'm not sure how many now. Their annual meetings pre-COVID had 700, 800, 900 people show up with training workshops and just all sorts of information and support and sharing of information about NGO money that was available, about jobs that are available, about how to do your job, about they would have public relations people show up and say, this is what we have to offer. This is, who we are. They would have editors talk about this is what we look for in a good story. They would have statistic sessions. This is how you understand statistics. And they're still there, and the meetings are still going strong. There were a few stumbles during COVID where people couldn't meet, but that is just a wonderful, wonderful resource. And so what we had when COVID hit was we had senior reporters and editors who'd grown up with AIDS, who'd grown up with SARS, grown up with H1N1, who knew what they were doing. We had these organizations. At the beginning of COVID, we were still, I think, hurt by fewer dedicated health reporters, but still enough. So I think that the U.S. reporters were very well situated. That said, now I have to tell you what's bad. I'm a journalist. That's what we focus on. I think we got rolled by the disinformation people, not active, when I say rolled, I think we got hurt very, it's hard for journalists to be as effective as disinformation people because, we have the facts to go by and there weren't a lot of facts. And that was a challenge for us. I think the other thing I think that hurt our ability to do as good a job as we should have been able to do was that political reporters came in and political editors came in and editors from other disciplines came in who, hadn't had the meetings, hadn't thought about statistics, didn't know the personalities involved. And I think so that was bad. And we saw them getting these headlines by writing some stories, I think, that were a little bit far out or that took one side or the other, or it became a personality thing. They got to do some of the profiles of some of the big people without the rigor and the cynicism, well, not cynicism, maybe that's a bad word, without the rigor and the care that an experienced healthcare reporter would have. And we saw them, getting attention, or we had editors, non-health editors, who came in and said, hey, why don't you do that? And then another thing I think that hurt us a little bit was that some of our major science organizations, and I'm going to try not to name names here, were not as forthcoming as this has been a fight between the Association of Healthcare Journalists and some of the government organizations that collect or create data on scientific issues. They were not as forthcoming as they could be, and that had always been true, and it was true through COVID, and I think that helped, that hurt our coverage. I'm going to stop. Oh, the one last thing I'd like to add is on our coverage, American coverage of vaccine availability in other countries, because that is a big global health issue. And it was there. Was it there enough? I think not, but maybe that's because I'm a health reporter. I don't know, the editors might think, oh, we did enough. We were so focused on what was happening in the US, but I would have liked a certain, when I'm talking about the negatives on our health coverage during COVID, I have to say that I would have liked to have seen more in that. So overall, I think we had a lot of things that put us in place to do a good job. Did we do a good enough job? No.
You don't know. But thanks, Joanne, for taking us into the various support structures the United States have. We can learn from these support structures, I believe, especially, as I said, from associations as Association of Healthcare Journalists, Pulitzer Center, and so on and so forth. But before we hand over to Marjan, who will tell us a little bit about the European support structures for journalists, let us look into the German perspective, because we have Jean here working for the Bayerischer Rundfunk, and she has been covering, as I said in my little introduction, health and medical topics for quite some time. And I think overall she can share some good experiences working as a healthcare journalist, but recently, due to shrinking finances, also some challenges. So,
yeah, thank you, Martina. It's a great pleasure being here. And I will do like Joanne. I have to tell you some of the negative details, structural problems we have, even if this is a perspective from a rich country. So it's my first time at the World Health Summit, and the reason why that is that I am based in Bavaria, in Munich, and we have a federal public broadcasting system. So this is out of my region, and normally I'm not responsible for covering topics in Berlin. So this is the Berlin colleagues, the main capital colleagues, but they are covering political topics. And then we have another broadcaster here, RBB, for Berlin and Brandenburg. And well, they are doing some topics here, or they're not, we don't know. So this is a kind of structural problem during the public broadcasting system in Germany called ARD, and my company is part of the ARD. So welcome to my world, and that's why I'm very glad being here. And we have the problem in the ARD broadcasting system that we don't have one centralized health editing board. We don't have. So we have in Munich at the Bayerischer Rundfunk, in Cologne at the WDR. RBB here in Berlin. So that is kind of a problematic structure, and that is kind of, we have a lot of talking, a lot of networking, a lot of communication is needed to get on point. So during the pandemic, we all worked together, and you know, we had very, very good health reporting here. You all know Christian Drosten and his famous podcast, and we felt very well informed during the pandemic for the situation in Germany. But as Joanne said, what we did not do, at the moment we have to look outside. For example, the distribution of the vaccines worldwide was quite a problem. So we didn't cover it really. We had the famous companies here like BioNTech, CureVac, and we couldn't really cover So we told the famous stories about BioNTech, the success stories. But when it came to how could we get the vaccines to the African continent, for example, I had no reporter to send on. So I don't have the funding because we have a correspondence system. So we have correspondence, some correspondents in the north of Africa and in South Africa. And we're talking about perhaps 3 or 4 persons, and that's it. And if I, from a science news desk, want to send someone to the continent, I don't have money for it. It's just that simple. So that's why we send people, freelance reporters with AJC grants, for example, to the African continents years ago, because we just couldn't fund it. And as you mentioned, I was covering HIV and AIDS for years for the ARD, audio broadcast system, and I was sent as a science reporter to the conferences because I'm a science editor. That was great. But HIV and AIDS is a good example as well, because it's quite another topic in Germany. As you all know, it's a chronic disease. It's not a big deal here. People can live with it. We have medication. It's no problem. If you go to the African continent, you're talking a total different story about HIV and AIDS. But to be able to tell that, you have to be there on the ground. So it was my pleasure and my honor. I could be there, but it was, it's not a normal reporting thing. I can't send people there. So that is our structural struggle, and that is not better after the pandemic. We had our topics, we had our moments, but there's still a lot to do, and we definitely could do better.
Thank you so much. This is exactly the point which we have to talk about, the shrinking finances for on-site reporting. And this is also one reason why we have invited Marjan to this panel, because of her organization and, of course, of other organizations as well. At least some journalists were able or are still able to report on site. Marjan, maybe you want to take us into the structure, the grand structure of the European Journalism Center, and tell us what your organization has done for global health reporting.
Thank you, Martina. Good morning. Happy to be here, albeit remotely. So I'm working for the European Journalism Center, as mentioned before. We are a foundation. We are an independent Dutch non-profit based in Maastricht in the Netherlands. And our purpose is to support, strengthen, and develop journalism and media. And we do that through funding. So we facilitate funding to help journalists do their work. Resources, we publish resources to further careers and enable innovative reporting, and we run events to connect journalists across Europe. So I am part of our grants team, and why is funding important? Well, it's been said before by all my previous speakers, the lack of financial resources, which is a big problem. And that's why we deliver grants. They facilitate and strengthen reliable and in-depth reporting, which for many media is lacking, because the media simply don't have the money to send people across the world, as the previous speaker already indicated. And why is it also important? It is a way to counter disinformation, misinformation, distrust in the media, as mentioned before, and it addresses gaps in knowledge and crucial issues. It also holds governments and decision makers to account. There is a downside, of course, to funding, and that's donor priorities. If their priorities change, there goes the money. So that's a little bit of a problem here. Because their agenda changes and then the funding changes. At the EJC, we have some donors that help us with grant funding. It's the EU, for instance, but our biggest donor is the Bill and Melinda Gates Foundation. And since 2013, so 10 years now, we had more than 200 journalism projects on development topics that were funded by the Gates Foundation. We have big grants for media houses. They are between 100 and 130,000 euro for a year of reporting. The reporting is on the Global South with a link to Europe, if possible, and the reporting is on the first 6 SDGs. We had European development journalism projects that were close to 2 million in grants. There were some projects on health in there. We have now running a solutions journalism accelerator program that gives grants in a total of about 2.5 million euro. There are also projects on health in there. But the one we need to discuss here is our global health and our global health security grants. These grants were for freelancers. They started in about, I think, 2016. It's also reporting from the Global South with a link to Europe on the 3rd SDG. We have had a total of 130 grants. The budgets for the grants were between 7,000 and 15,000 euro per grant. And in total, we spent well over 1 million euro on grants for freelancers. How do we do that? Well, we have a call for applications. People send in their ideas, they're reporting what they want to do, and then everything is sent to an external jury. We have no influence whatsoever on the projects that get chosen, neither does the Bill and Melinda Gates Foundation. It's an external jury that decides which projects are the more interesting projects, and these get funded. A lot of questions are asked about independence. It's funded, so it must be an advertorial, or Bill and Melinda Gates will have some influence. No influence whatsoever. There is editorial independence. There is no interference. The freelancers can report on their story the way they like. There is nothing that we do to interfere. There is one small thing that we like to see, and that's there is a solutions angle to the stories. Doesn't have to be, but we will talk about that later.
In a little bit, exactly. Yeah.
We have global health grants for the last 5 years. Let's say we had about 300 stories published, and we had publications in more than 130 outlets in Europe and beyond. There were a lot of topics discussed, also underreported stories. I mean, of course, they talked about COVID, vaccine equity, vaccine hesitancy, Ebola, malaria, AIDS, new pandemic threats, mental health, neglected tropical diseases, addiction, cancer, multi-drug resistance, etc., etc. The list is too long to discuss here. Mm-hmm. And of course, we had a lot of impact as well, because we had a wide reach. The publications were in more than 130 outlets. There were many tweets, retweets, stories in social media. Our journalists won grants. There were conversations with experts and officials. Lots of stories got syndicated. There were even formal investigations done through the stories of our grantees. Our journalists got invited to speak at conferences, etc., etc. So it shows that these grants are very important for the stories to come out, and we are very grateful that we can be part of this. Thank you.
Yeah, thank you so much, Marjan. I absolutely agree that these global health reporting grants are a great source for journalists to really be on the side, and no one knows better how important it is than working on the side than the journalists themselves. We cannot report on global health topics from our desks. We need to be on site. So this is one very important thing we need to know. Being on site is crucial, but another thing is important. We talked initially about education for journalists, specifically for health journalists. Not everybody can turn into a health journalist overnight. Everybody has criticized journalism and misinformation, miscommunication, but one reason for this is actually the lack of proper training on global and public health on the side of the journalists. That's why we have trainings for journalists here and there, but not widespread. For example, in Africa, Gwen will tell us a little bit about the Center for Health Journalism in South Africa, and Luz will briefly elaborate on the advantages of the Atheneo's Masters in Journalism and the Health module. So since our time is running out and we want to keep 15 minutes for hour, I'm a little bit under stress now because I realized we already have 10 o'clock. So let us briefly look into these support structures, the education for health journalism. Gwen.
Well, I'll be very brief, given time constraints. But it has been confirmed that support in Africa excuse me, for specialized news desks and journalist training is increasingly the focus of media development assistance in Southern Africa. And there are more efforts by donors to establish or to help set up science journalism organizations in African countries. Some of the examples are the Media for Environment, Science, Health and Agriculture in Kenya, the Health Journalism Network in Uganda, and probably one of the better ones also is Bekisisa Center for Health Journalism in South Africa. Another example, I would say, that of effective health journalism support comes from Internews, where their Voices in Health program initially trained hundreds of journalists to report responsibly on HIV and AIDS. In Namibia also, the Namibia Media Trust, which is the publisher of the Namibian newspaper, I work with very closely in the mentoring and training of journalists and promoting excellence, whether it is in health reporting or any other field. So I think there are some positives in Africa regarding training, but it brings us just to another question, which is, of course, do we need or can we ever afford dedicated health journalists? You know, I think in Africa we're probably going to have to hope for a high caliber or quality journalist who has a general beat. I don't think we're ever going to have the funds enough to have a dedicated cadre of health journalists, unfortunately. But I think journalists should be obviously reliant on the facts. And if those journalists can be working with people in the communications industry, in the health areas, in the ministries of health, doctors, physicians, whatever it may be, will be better communicators, then I think the journalists will also learn in the process of doing their health reporting with experts who are helping empower them to do their job.
That's a very crucial point, Luz. Would you say that we have enough, you have enough dedicated health journalists in the Philippines because of your trainings, or is this just a very small beginning, a little start, which might not be enough?
I think what you did with our center to teach health reporting was a very good start, because I think it showed the lack of training of many journalists. But you know, I'd like to point out that the crucial role that a funder like Konrad Adenauer Stiftung played in ACFJ, because they introduced an innovation long ago when we started, and this was online education. Long before it was necessary or it was fashionable, we were already doing online. And this was very useful for journalists who did not have the time to go to school or did not have the time to, you know, for face-to-face education. It was very, very useful and very popular among journalists, not just in Manila, but also all over Asia. So we have around 300 journalists from different countries who have taken the courses. You have met some of them. So what's good about it is that because of this innovation, we've built a community of practice. We have alumni from across the region in different higher levels of media organizations. And they're all interested in further education, but it takes money. It takes money to train, to pay for good teachers, and journalists don't have the money to shell out, tuition money. In the Philippines, what was in our university, what made the program very attractive was that we opened fellowships in a master's program, and it was very popular. So we're still keeping that the master's program. It's just undergoing some revisions because of the changing times, and we also hope eventually to create our own platform where we can produce, where we can publish our student stories, so that they don't have to rely on their own news organizations for space or for airtime, which they're likely not going to get.
Thank you, Lou. So education is one key to quality journalism, and also the trainer concept, in a way that those journalists who have been trained pass on their information to future journalists. But still, we have the issues of financing, the structures. We have heard that we need organizations to give grants, but are these the only ways to improve that quality journalism stays alive? Do we really only need funding? So what do you think, Joanne, are keys to quality journalism from your perspective, from your US perspective?
Oh, that's a big question. One thing I think that's been mentioned by a few people is that the funders allow the money to be spent the way the media outlet would like to spend it, rather than come in and say, well, you should cover it this way. There can be, I think, some sort of hints, if you're getting money from the Solutions Journalist Network, that if you're applying for it, you better have the idea that you're going to at least explore possible solutions, not necessarily recommend it. So there's some guidance, I think, that can be lived with. But one of the areas I would say is that when the funders do come in, that they allow the money to be spent the way the journalist would like to. Mm-hmm. Of course, I'm going to say that I'm a journalist, but I think it's very important for the public too, because if the public knows, gee, the money's coming from somebody who wanted the reporting to go a certain way, they're going to be suspicious of it. So I think that's number one for a good way for the funding to go. Two, of course, is more. Always need more funding, and that's always a good thing. Three, I think, is something I didn't think I was going to say, because I'm, to me, podcasts, the rise of podcasts and the rise of social media is basically the death of editors. I mean, so many podcasts come out that don't have professional editors, that don't have people in there who are going to be reminding who's ever providing the news that there are certain standards of truth and of fairness that you need to ascribe to if you're going to have good and accurate journalism, especially health journalism. So I would say one thing I would always like funders to do more of is to fund more education of editors. I always tell, sometimes I get complaints from, I deal with a lot of NGO health providers, not journalism NGOs, but health NGOs who will say, why don't you do a story about this, or why don't you do that? And I always, especially when I was on staff, I'd say, I would like to do that story. Talk to my editor. And so I think if NGOs start paying a little more attention to editors, I don't know how they would do this, and I'm just thinking of this now, and maybe I should think it through a little more before I say it, but somehow getting things like podcasts and influencers are out there just without any brakes on them, and how can we introduce some sort of professionalism into there? I think that deserves some thinking. But overall, I would say more money, continue with not telling people what to do as much as you can, and promoting and promoting professional editors.
Yeah, these are good points, Jean. Would you underline what Joanne just said, that especially it's also about the education of editors. They need to know what stories they give to freelance journalists so that a proper reporting can be done. Is this a point which you would also underline, what Joanne just said?
I would absolutely, and I would add that we have a special problem about consuming news, or how the news is working. Because I give you an example. You remember the Ebola crisis some years ago, and there was this crisis on the African continent, and no one was interested. So we had some little news programs, of course, the BBC or cultural news programs, just they were covering, but very, very low level. And then you had the first 2 patients on the American continent. Mm-hmm. And at that point, it got interested to the whole world. And that is a problem. And that is really a problem. We are not interested in what's happening in some parts of the world. Or another example was the CRISPR technology, the gene editing theme, which is a revolution in biotechnology since 2012. And the first time it came to the news was when a Chinese scientist gene edited 2 babies, cutting off the HIV gene. And that was years after a scientific discussion we had all over the world, but no one was interested and no one knew about. Yeah. And that is a problem of how news is working. So you can fund, you have to train, but we have to reflect on how we consume news and how we get these important informations into the news, not only to some podcasts or some cultural reporting. Yeah.
Gwen, you want to add something to that?
I just wanted to add very, very quickly that, something we probably, or I probably should have mentioned right in the beginning, and that is to interrogate what actually is health journalism. Mm-hmm. And, it covers, in my mind, a huge variety. If a journalist is going out to talk about people living in poverty, conditions in marginalized settlements, climate change, corruption when it comes to the misuse of public funds. There was a lot of it during the COVID pandemic on the African continent, and several countries' ministers were even suspended as a result. So we need to look more closely at that, because health reporting sounds, and I don't know whether, people feel very interested in it and think it's boring and just dictating to it. It isn't, of course, science. It's about things that affect the lives of people on a daily basis. So I think it's important just to put that out there, that it's a very, very big field that we're covering. And expertise in that, a good reporter with great skills can be also a good health reporter without very specific training only in the health field. Yeah. Just thought I'd mention that.
Another point, I think, which we have talked about when we were preparing this panel, Marjan, is that we could focus on solutions. Right. What does it mean, solution journalism? Do we always need a solution which is already included in our articles so that the reader understands? Maybe you can just very briefly, and then we open up to the floor. Maybe you can briefly elaborate on what solution journalism is all about. Is this a key for quality journalism?
Thank you, Martina. I will keep it short, as I know we're running out of time. But yes, solutions journalism. We are currently running the Solutions Journalism Accelerator. It's also funded by the Bill and Melinda Gates Foundation, because we think solutions journalism is important. Why? A Reuters research paper in 2023 showed that 36% of the people are avoiding the news. Why? People get tired of hearing only about negative things, natural disasters, war, crime, suffering. It leads to a feeling of powerlessness. It has a negative impact on their mood and their well-being and their trust in journalism. So I think, and we think, that there is an important role to play for the media to counter that intentional news avoidance. The news content has to be less negative, more constructive, less opinionated, and more fact-based and transparent. So what is solutions journalism? Well, it investigates and explains how people try to solve widely shared problems. While journalists usually define news as what's gone wrong, solutions journalism is leading an effort to expand that definition. Responses to a problem are also newsworthy. By adding evidence-based coverage of solutions, responses, journalists can tell the whole story. You can learn from others who are working on responses elsewhere. So does that mean that we only have to have solutions focus in stories? No, not all the stories fit the solutions approach. Every story has its timing, and the same goes for solutions journalism. But we feel that it's important that people feel empowered instead of just, getting depressed by all the negative news that you hear. A big question usually is, by focusing on solutions reporting, aren't we advocating that a problem needs to be solved? Because advocacy is a tricky word in journalism. But solutions journalism isn't about telling people what to do or what's best for them. It's just solutions journalism just shows the whole picture. Audiences should be equally informed about solutions to problems as they are about the problems themselves. So we feel that there needs to be a change of perspective. And if you look at the slide, you see that we lose readers, we lose listeners just because of the news avoidance. And it's important that that people feel empowered. And that's why solution journalism can be a way to go. I mean, there are more ways to go, but solutions journalism is one of them.
Yeah. Thanks, Marjan. That's a very valid point. We tend to criticize, we tend to describe, but actually we also want to present solutions. Maybe sometimes we don't see any solution, but we can at least think about a potential solution, about the various problems we have been seeing in global health. So now the floor is yours. We've been talking a lot, and there were many aspects we needed to cover, and we could still continue, I'm very sure. But time is running out, and we want to give you the opportunity to also ask questions to our speakers, to our panelists, and so also maybe, if there are journalists amongst you, to share experience from your work and from your background.
I'm Elaine Fletcher, Editor-in-Chief of Health Policy Watch, which is a Geneva and Cape Town-based global health news service. We reformulated ourselves in 2019 from an older news service called IP Watch, and we're covering now 5 broad areas of global health, including AMR, infectious diseases, NCDs, health emergencies, and health, climate, and development. So we've painted a very broad spectrum, and I think what's unique about our approach is we're also trying to create a network approach between the global north and global south. And 2 comments I wanted to make. I won't try to. One is that I think the education element is great. We've also conducted workshops with Konrad Adenauer, with CAS last year, to train journalists on how to cover the World Health Assembly, which is a really obscure, difficult thing to cover. But I find that the ongoing mentoring and just working with journalists day in and day out is what's really important and makes a difference. And providing that platform also where they can get paid, because, one-off training, and those seem to be really popular, are great, but you really need that ongoing experience, especially for some of the more complex and multifactorial topics that we're now being asked to cover. I find a lot of the journalists we work with, we have networks in Africa and in Asia and a bit in Latin America. I'd love to get someone in the Philippines, by the way. But a lot of the journalists are very well trained to cover TB, malaria, polio, those sorts of things. But when I want to try and get them to talk about air pollution and climate change or AMR and One Health, those are things that really need a lot more work in order to bring people up to speed. I say that because I worked for WHO, for the World Health Organization as well, for 15 years in their climate, health, and environment department. So it's something that's really a passion for me, is trying to bring those pieces together. So the other question I guess I would just bounce back is, while the NGO funding is important and can be very important, for us, at least, I find that we have collaborations going, but often the global health community, and this would be said to the global health people in the room, want to cover their issue. They don't realize that it's really important to have that broad and neutral base in order to cover their issue. We can't just, if we're just out there looking as we're another propagandist on one particular topic, it's not going to have nearly as much impact as if we're really talking about all the topics. So I ask all the global health funders in the room, when you're thinking about dedicated funding, remember that dedicated funding that's for a broad core purpose is so important. And as much as also half of our readership is in the Global South and half of our funding goes to the Global South, but we also need the experienced journalists. My deputy editor is in Cape Town. She's a veteran of the whole HIV thing. We need that to be able to make things work. So we need the young people and we need the older veterans to sort of bring, I don't know if you can bounce off of any of those issues, but those are my comments and questions. Thank you.
Definitely. Thank you so much. Yes, here in the first row, the lady.
Hi, thank you so much for this very interesting panel. My name is Claudia Wilmes. I work for Cell, one of the leading biomedical journals. And my question to this panel is, what role do you see could academic publishers play better in having better reporting on global health? Because I see, especially in the COVID pandemic, academic publishers have made their content freely available, and this has significantly improved reporting on the matter. And of course, this is not sustainable. But I'm wondering, like, how academic publishers can better support journalists.
Do you want to address this question to someone specifically, or just to, yeah? Maybe anybody want to add something to this, Luz?
Probably, as you know, in the Philippines, there's very little use of medical journals in popularizing health stories. I think that's one area that needs to be developed. Especially, there's so many medical health emergencies cropping up all over the archipelago. That link hasn't been strengthened. That's where one of the gaps lies in the Philippines, I think.
My name is Helmut Brandt. I'm a professor of European Public Health at Maastricht University, where we run courses in public health. But half of my professional life I worked for ministries and had contact to the journalists in this way when scandals were there. Yeah. And now I'm doing the same in India. What my observation was over the years, that there's a mismatch, that those who are interviewed don't know what the interviewee thinks and would say, and the other way around. It's from using words, using different slang, and misunderstandings are common, more misunderstanding than real information. Yeah. So what I would suggest as a long-term goal, get in contact, for example, with schools of public health and offer them 2 or 3 lectures about how to communicate with journalists. And there is a European Association of Schools of Public Health, ESFA. There's an American Association of Schools of Public Health. There's an Asian one. And you do it perhaps even as a video that you record once and give it, because the next generation of young public health professionals need to know how you are thinking. And so that they can use the right words, know the right expectations. When you're managing a scandal, you're afraid to talk to the press. Global health activists love to bring their message over, so it's more emotional. So between those 2 extremes we are living, and I think to get to the next generation is something where you would then make the life easier for both parts.
Thank you very much. So bridging the science-media gap. We have one more gentleman here and one brief answer to your advice over there. 1 second, you briefly want to comment on this?
Yeah, I just wanted to, because it's being well together. We as science or health journalists, we are translators. We have to translate complex things. And so for you, it's important to be as simple as you can be without being, well, giving false information, and the same for the researchers. You have to know that you are a complex thinker, and the journalists, their focus is on being as simple as possible. We have to translate things. So there you have to make the connection.
Very important point. Now the gentleman over here, and then there was Anna over there. So.
Thank you. My name is Joachim Heidebrecht. I'm working for KfW Development Bank, which is a German donor agency. And we are all struggling with fake news in the area of health. I listened yesterday to one session on the nexus between health and climate, and the Secretary of State of Brazil said they want to fight fake news by new regulations. And my question to the panel is this a good idea, or is it an attack on the freedom of press?
Anybody wants to answer briefly?
I could answer
yes,
briefly,
Gwen.
just to say that, you know, obviously this is a huge danger ultimately to the freedom of the press globally, where, and I think we can say that it was Donald Trump we have to thank for starting this era of so-called fake news. Most of us in media say there is no fake news. There's either news or it isn't news. But what we now know is disinformation and propaganda to a large extent. And many governments pretending to want to legislate against that, it happens on the African continent as well, are doing so under the guise of really clamping down on free speech and freedom of the press. So we need to be very, very careful around those things indeed, and I'd be very suspicious of those attempts myself.
Thank you, Gwen. Anna, one last.
Hello, my name is Anna van Rönne. I'm managing editor of Healthy Developments, and that is the portal health.bmz.de. And I wanted to talk about another area, which another important nexus, I think, about how to get the news from the global south to the global north or across the world, which is basically conversations between journalists and writers and people working in countries in development cooperation programs, and to actually see what's happening on the ground, and I think who mostly also bring the right critical attitude toward it. And I think I would like to laud BMZ that since 2004 they are actually funding this initiative, which is very much about talking about learning in German development cooperation in health and social protection, so that our writers actually allowed to take a critical eye and to really sit down with the people who are doing development cooperation and their partners to talk about what has worked and what would you be doing differently next time around. Because development cooperation projects come in with a plan, and then reality happens, and then the plan gets changed, but something is learned on the way, and that's what we are trying to capture in our articles. And this is, I think, might be a useful source also for journalists in general. But, it's also just to say, I think actually talking to people, we are also, we can't travel there all the time. We do our work via interviews with colleagues on the ground, but, that actually generates good stories, I think. Thank you.
Thank you, Anna. We have time for one last question. I was given a sign 2 more minutes, so I see 2 hands raised. I don't know who was first, so maybe we can cover both. So please, go ahead.
Thank you. My name is Arthur, and I'm from the International Pharmaceutical Students Federations. So as youth organizations, I think a lot of students from our organizations wanted to sort of go to the forefront of these sort of health policy changes like the summit and something like that. But again, I think we as youth, or myself, feel that strongly about the funding issues where we have seen participants failing to go to the summit mainly because of funding issues. And we wanted to actually bring the perspective of these sort of world-changing events back to our youth, back to our future pharmacists. And often we lack funding and we lack training on this. And I just wonder if there is any initiatives or any plan that the journalism sector could sort of help whether that's financially or educationally, to help us sort of do these. And also, I think the other thing that we experience is sort of interpreting the health journalism or the health journal. For example, I think I personally feel this the most because when I was sort of organizing, doing my internship in a university, I was organizing press release materials and the journals from the reporters. We feel that actually when we sort of promote the same research article, there are different perspectives and different focus from different sort of media and journal representatives. And I think as healthcare professionals, we sort of need training to sort of know what you guys are thinking and then sort of give a correct or give a focus or like know how to talk to journalists to make sure that our focus is put.
Thank you so much for your comment. Unfortunately, I was given the sign that we have to come to an end right now. I want to thank all our 5 panelists very much for being here on site and remotely, for sharing their life stories, expertise, ideas. We have heard about the need for education. We have heard about the need for further financing, the need for transparency, and also the need to look at solutions. If we can somehow put all these different aspects together, I'm very sure that global health reporting can be quality reporting in the near future. And I hope this won't be the last panel on global health reporting, but only the first one, and there will be many more. Thank you so much.